Here is a quick recap on the theory of muscle energy technique. In particular, we're going to talk about PIR, Post Isometric Relaxation. Before we talk about that, I just want to recap on the nervous system, which you covered in your anatomy and physiology, and also the reflexes within the body, because this is what we're going to leverage when we do MET on a client. So the nervous system, at its most simple sense, both relays and sends information to and from the brain to various parts of the body. For example, it has sensory function. The skin, for example, can touch something hot and send that message to the brain. The brain can then process that information and send information back to that part of the body to action something, a motor function, and move the hand away. So we constantly have this sensory and motor communication going on in the nervous system. It can be both controlled consciously and unconsciously. Your hand can be pulled away before you even had time to process that what you were touching was hot. So we have this constant voluntary and involuntary control that is managed through the nervous system. And reflexes are automatic responses, so they're part of that autonomic system where the nervous system can respond to a stimulus in a certain way. For example, anyone who's had a child or been around a new baby has seen the suckling and rooting reflex, how babies instantly know when they come out from the womb how to root and look for the breast or a bottle to latch onto, and then they have that sucking reflex. We have the gag reflex that stops them choking as they learn to eat. We've all seen that knee-jerk response, the traditional picture of the neurologist or doctor with a hammer to the knee and seeing that contraction and that jerk in the knee. And even blushing. It's a reflex to an emotion, to a situation that we cannot control. So I want to talk about two specific reflexes because I think one of them is used in MET, but the other, and understanding the other one, helps you understand what's going on and how we're leveraging the nervous system. So the first one is the stretch reflex. So if, for example, you put your hand out, your elbows bent, and someone drops something quite heavy, say a heavy book, onto your hand, you would see a jerk response. What is happening in effect is that that book, that weight being placed onto the hand, starts to stretch your bicep, for example, so it starts to bring that elbow into extension. But it happens quite quickly, and your body doesn't want to let that book forcefully push your hand towards the floor. So you get this contraction in that muscle that's being stretched too quickly. But we also have the inverse stretch reflex, which is also a protection mechanism. So as our bicep contracts to hold that book and stop it moving too quickly and tearing your bicep, what if something is placed in your hand that creates too much tension rather than stretch? And actually trying to contract and hold it might cause more damage than letting it go. What we then get is this release or this lengthening through a muscle to let it go. So if we want to create a lack of tension in a muscle or to increase its range of motion, reduce its tone, then maybe creating a way that we can leverage that inverse stretch reflex, but in a safe and controlled way, may get us some of the results that we want. And this is where muscle energy technique comes in. So muscle energy technique is a broad term that's given to a number of techniques that target the nervous system with the view to reducing that tone in the muscle. So it can be used to increase range of motion in a joint. It can decrease tone in a muscle. You can use it before, during, after a treatment. And it can be applied in a non-therapeutic environment on the gym floor, pitch side, for example. So it's quite a useful technique, and it allows us to create a result in a muscle without actually having to touch that muscle or apply massage to it. And that in itself is attractive. So what we're going to teach you on this course is one type of muscle energy technique in particular, Post Isometric Relaxation, and it stimulates this inverse stretch reflex. So the clue is in the name, post, after. Isometric contraction is a resisted or non-moving contraction. We get a relaxation or a reduction in tone in the muscle. So what is the process for applying PIR to a client? Well, as always with all our techniques, let's palpate the target muscle to give us a before and after, and also to give our clients that feedback. We then perform an active range of motion test to see where the client is at and whether or not MET is indicated. Because if they have already large ranges of motion or abnormal ranges of motion, then MET may not be the right technique for them. We then perform a passive range of motion test so that we can see what's happening when the client is relaxed. If we decide we're doing MET, we then find the initial barrier, so where we feel that drag or that initial contact or contraction in the muscle. We then get the client to kick down, push down, contract that target muscle, using about 10% of their force, or simply asking them to meet your resistance for 10 seconds. As they inhale, coach them to let go and relax as they exhale. That can take up to 10 seconds, so you just need to palpate and feel for when your client lets go. Don't move too soon. It's worth waiting until they've relaxed. And then slowly move to the next barrier and hold for 10 seconds. We might choose to repeat that 3, 4, 5 times depending on the client. But when you feel you're coming towards the end, we don't want to be pushing them into a deep stretch. So we want to make sure it's when we feel we're at the end of range and not pushing beyond. Simply hold that last one for 20 seconds to allow the body and the nervous system to acknowledge that new increased range of motion. Retest and palpate, and you should see a difference in that tissue as well as the range of motion, and results can sometimes be quite startling, especially to the client. It can be quite a visual increase in the range of motion. Again, reconfirming to their nervous system and their mind that we have made a difference. Ensure there's no pain or contraction. If there is pain when they kick down or resist, then this is an indication of injury and you should not perform the MET.